Hello and welcome everybody. Welcome to the Animal Eye Guy. Today we're going to be talking about deep or melting corneal ulcers. So a corneal ulcer is a defect in the surface of the eye. We call it the cornea. The cornea is about 0.5 mm thick and is made up of several different layers. So it's got an outside layer, the middle layer, which is mostly collagen, and then a very, very thin inside layer. And when we talk about ulcers, we always try to work out, are we dealing with a superficial ulcer, which is something that may respond to medication? Are we dealing with something that is deeper but might still respond to medication? Or are we dealing with an ulcer which is very deep, where we worry about the structural integrity of the eye, and may need to reinforce it with some sort of surgical procedure, or has it gone all the way through? So deep ulcers are usually cases that we see as emergencies, and most of these cases we would recommend doing surgery on them, um, in order to try and avoid the eye from rupturing, and which may potentially lead to loss of the eye. A melting ulcer is a condition where the cornea surrounding the ulcer starts to get eaten up, either by the cornea itself. So the cornea is a very, very difficult and complex structure which contains all sorts of proteins and enzymes and other cells. And sometimes these cells can start doing the wrong thing, where they start instead of reinforcing the cornea, they might start eating away at the cornea and making matters worse. In some cases, that can be triggered by particularly nasty bacteria. So there's a bacterium in particular that we're worried about called Pseudomonas, which is one among many which can start to eat away at the cornea very quickly. So ulcers or melting ulcers can be triggered by many, many different things. It depends on the breed, it depends on the age, it depends on lots of different things. If it's a younger patient and a patient who we wouldn't expect to have a very deep ulcer, it could be due to a trauma. The majority of cases that we see as referral cases are dogs which have had an ulcer, or particularly short-nosed breeds with very, very exposed eyes, and very poor lid conformation. Usually they also have very poor tear production, and a very simple superficial ulcer, which in a Cocker Spaniel or a Labrador would heal within about 2 or 3 days. In these patients, it can go the other way and can start going very deep very quickly. And a deep ulcer is a condition that usually requires some sort of surgical procedure to reinforce the cornea. Um, so that's why we tend to see these patients very quickly. A melting ulcer, as I've already alluded to, can be triggered by either the incident itself, which has triggered some of the cells in the cornea to start eating away at the cornea, um, or certain types of bacteria which can release toxins, which will then do that process and start eating away at the cornea. The majority of patients that we tend to see with these deep ulcers are short-nosed patients, so French Bulldogs, Shih Tzus, Lhasa, Apsos, English Bulldogs. Any dog can get a deep ulcer and any dog can get a melting ulcer, but the majority of cases that we tend to see are short-nosed patients. That largely depends on the depth of the ulcer. It depends on whether the patient is healthy enough to undergo anesthetic. Um, it depends on whether this is a so-called melting process. So it depends on a lot of factors. But by and large, if we have a non non-melting ulcer, which is very deep, and the patient is healthy enough to undergo anesthetic and owners are able to put eye medication in afterwards, we do recommend surgical reconstruction of the eye using some sort of grafting technique. For melting ulcers, we tend to start with very intense medical treatment initially. In some cases, if they already come in on very intense medical treatment, we may perform a procedure called a corneal cross-linking procedure to try and stop this melting process and reinforce the cornea and make it harder, or a combination of both. In some rare cases where either the eye is beyond repair, or the patient won't allow medication, or for whatever other reasons, um, if the ulcer's gone all the way through the eye and has ruptured the eye may need to be removed. However, in most cases, even if the eye has ruptured, there is still a chance that the eye may be able to be reconstructed. So most deep ulcers, which are not treated, will progress to a full corneal rupture. In very, very rare cases, the eye may save itself before that happens. So the eye, or the cornea, is a fascinating organ which can basically send signals for blood vessels to come in, and those blood vessels are there to repair the cornea. Now, oftentimes in very fast progressive conditions, we don't have the luxury of time to wait for those blood vessels to grow in, because they grow very slowly. They start growing in about 4 to 5 days after the incident, and then they grow about a millimeter a day, which means that a lot of these ulcers, particularly if they're in the center of the eye, it could be 10 days to 2 weeks at least before the blood vessels have even reached the area of the ulcer, and by that time it might be too late. So an ulcer which is non-treated and which is deep or which is melting, if no treatment is performed, the eye will most likely be lost in most cases. So hopefully you found this video informative, and if there's any questions or comments, please fill those in below. Thank you very much. Bye-bye.